I think you're referring to some of the safety letters that recently came out with Idelalisib. Those don't necessarily relate to the transaminitis that is the topic of the poster that we have here at ASCO. Those really relate to the risk of infection for patients who are on Idelalisib. In general, those infection events were seen more commonly in previously untreated patients where Idelalisib was their first treatment. When the randomized trials comparing Idelalisib with Chlorambucil, for example, a standard first-line therapy in CLL, when those randomized trials were done, there was a higher incidence of death among patients treated with Idelalisib, and that was a safety signal. Now, the incidence of death is a very low level, and these are large randomized trials. But the signal was strong enough that the company felt that there was a need to halt those studies. And I think the message here is that Idelalisib probably isn't an appropriate treatment first line for patients with CLL. It is very active and has a place in the salvage treatment for patients with CLL. And I think physicians need to be aware of the risk for infection and vigilant looking for infections. Patients should receive routine prophylaxis for herpes virus as well as for PCP, pneumonia. And monitoring, the company has recommended monitoring for CMV, at least on the clinical trials. So I think the important message there is the vigilance and looking out for infection and being aware that there could be a higher risk for infection. In the salvage setting, for CLL at least, the competing risk for patients, the risk for patients is death from their disease, and it's an active treatment, and so the risk for infection is minimized by the overshadowing risk for death from the disease when we look at that group. In the previously untreated population, that's not the case. The patients generally do relatively well, and their risk from death from their disease is less than in the salvage setting.